Hi, I'm Mr Shyamalan, consultant hand surgeon, and this is a patient educational video on carpal tunnel.
Hi Mr Shyamalan, I wonder if you could talk me through what could I expect in a consultation with you?
Of course. Usually your general practitioner has referred you for the symptoms that you have. Symptoms are what you feel, perhaps pins and needles, night pain, tingling, waking up from sleep and sometimes shaking your hand. Occasionally the fingers start to actually lose sensation and go quite a dead feeling, pain radiating up the arm, and weakness, dropping things, struggling to do shirt buttons, bra straps, etc. On an examination point of view, I can actually look at your hand. So if you put out your hand for me and I'll say, you can look at the muscle bulk around the thumb, and the nerve that supplies the thumb comes from the neck. And it runs through a tunnel called the carpal tunnel. And it also supplies the sensation to the thumb, index, middle, and some of the ring finger. So sometimes patients complain of these fingers are the tingly ones, but you could also have all the hands as well. And turn the hand around, we look at the general muscles of the back of the hand. I look at the elbow and the shoulder because you can get problems there, and obviously examining your neck as well. So carpal tunnel can be give a whole range of symptoms.
Thank you. Would I need any other investigations done?
Generally, carpal tunnel is a clinical diagnosis, which means through the history, the symptoms and the signs that I can see on examination, I should be able to diagnose it. I think the nerve test is a very useful test to have, and the nerve test looks at how quick the nerve impulse works. So if you imagine a motorway and you're looking at the speed that the car travels down the motorway. If there's any blockage in the motorway, obviously that is slowed down. And also if there's damage to the road, you can tell that actually it's going to take longer to recover, and sometimes irreversibly damaged. And that's where the nerve test is very useful in giving us a more objective outcomes. Normally it's mild, moderate or severe. But I would say most patients you can do a clinical examination and have a reasonably good management plan.
Thank you. And could it be confused with anything else? For example, if I was experiencing pain further up, would that still be linked to carpal tunnel?
Well, what I say to patients is actually carpal tunnel does cause symptoms along the whole nerve tract. So the nerve, as I said, comes from the neck, so any radiated pain you can feel up the whole arm. But you can also have other pathology. You can have neck problems that can sensitize the neck and also sensitize the hand as well. You can have shoulder problems. But I'm pleasantly surprised how by treating carpal tunnel, a lot of these symptoms do improve. So yeah, definitely the pins and needles, the numbness, tingling, that can be improved. I'm always happy that a lot of these other symptoms higher up the arm are improved as well.
So what would my treatment options be?
I would say in early carpal tunnel, it may well be positional or occupational. So make sure perhaps the wrist doesn't fall into a fully flexed or fully extended position. You can use a wrist splint for that, maybe at night if it wakes you up. Avoiding certain activities, perhaps repeated flexion, extension or gripping that may be triggering off some of the symptoms, and just gliding the nerve in the neck and the arm and the elbow, just making sure everything's nice and mobile, sleeping in a nice comfortable position at night. If that tends not to improve after a period of time, or the symptoms are progressing, then we can certainly consider injections. Injections aren't cures, and that's injections of steroid. They help the symptoms. And in the early stages, if you haven't got any muscle wasting or the sensation is normal, I think it's reasonable to try if symptoms are the real issue. But unfortunately, the injections do help with pain but don't cure the problem. So it'll either resolve of its own accord or progress, and in which case the other option is carpal tunnel release.
And could you talk me through that, exactly
Sure.
What would happen?
It's actually a nice operation to do, and it's very useful for helping the patient's symptoms. And in the toolbox of hand surgery, it's definitely one of the better ones. It's a local anaesthetic day surgery procedure. Patient can eat and drink beforehand. You make a small incision down the front of the palm, and normally I use adrenaline, so I don't need a tourniquet. And say it takes about 15-20 minutes. We don't touch the nerve itself, so you just release the sheath over the nerve, which forms the carpal tunnel, which essentially is a ligament. And as you release that, the nerve tends to breathe and have a bit more space, and those pins and needles symptoms do improve. Stitches afterwards, normally the wounds heal by 2 weeks. So I advise patients just to keep the hand clean and dry for a couple of weeks, and then just start slowly moving the hands and using the hands for light things, using cutlery or light writing pens, but not doing any heavy lifting until the wound is healed. At about 2 weeks' time, perhaps we can start some use of the car and slightly more heavier lifting, with a view to doing most things by 6 weeks. If patients have quite compressed disease and they've lost the sensation to the fingers, that may take many months to recover.
And would I need any physiotherapy after surgery?
As a general rule, no. But like any surgery, there are pros and cons of surgery. So scar sensitivity is quite common, and sometimes the therapist can help desensitize the scars. And likewise, stiffness in the fingers and the wrist, the therapist is quite useful to help that. If there's any signs of early infection, we can treat that with antibiotics. Recurrence, which means that the problem comes back, or you still have ongoing pins and needles even after the decompression, or the sensation fails to recover, are kind of more delayed problems, but are something that we know about. And recurrence can be early or late, so you can have a great result for 5 to 10 years, but afterwards it can come back. Thankfully, that's in a small percentage, and most people who have the procedure are quite happy with it. Like any procedure, you have to do the small amount of rehabilitation time afterwards, but generally the outcome is pretty good, and functional recovery is pretty good following this procedure.
Great, thank you.
Thank you.